So hello everyone. My name, for those of you who don't know me, is Dr. Brian Reedy. I'm a board certified plastic surgeon here in Wyomissing, and I'd like to welcome you to our next segment of our Facebook Live. We've done a number of these posts and people have really enjoyed them. What we decided to feature today was a branch of non-surgical plastic surgery, our skin care, and how to make your skin look better. I'd like to introduce you to part of my team today. Donna Erb is my esthetician. She's my lead esthetician. She's been with me for 12 years, and she's actually president-elect of her Society for Plastic Surgery and Skincare Specialists. My associate, Dr. Scott Lindsay, he's our guinea pig and our patient today, and we're going to talk a little bit about microneedling and demonstrate microneedling, tell you what it's about, show you how it's done, and then we're also going to cover some topics about how it fits into a larger skincare program and what our approach is here at Berks Plastic Surgery. So with that said, I'm going to introduce Donna again. I'm going to let her talk a little bit about it, and we're going to get right into the procedure. This has been a great interactive tool, so I'd really encourage you, ask any questions at all, and we will try to get you the answers you need. In addition, we ask that you like and share it. As we had done in our post, anyone who likes and shares this Facebook Live will be eligible for 20% off this treatment, and we're also going to do a drawing for someone to actually have a free treatment, assuming, of course, that it's an appropriate treatment for them. So with that said, I'm going to let Donna take over. Donna Erb, tell us what we're going to see today.
Okay, so we're going to do microneedling on Dr. Lindsay. I'm going to have him lie back here. Microneedling has been around for quite some time, and we have been doing it here for at least the last 4 to 5 years. So microneedling is wonderful to help to stimulate the collagen, as we tend to lose that, and the elasticity as we get older. And this is great for the large pores. It's great for acne scars. It's also really good for stretch marks. It's great for any skin type, any skin color. There's really no adverse side effects. It is recommended to do 3 to 6 treatments spaced about 4 weeks apart. So Dr. Lindsay is numbed. He's been wearing the numbing cream for about 30 minutes. So I'm going to cleanse off the excess residue so it does not clog the microneedling pen. So I'm just going to cleanse his face here and get started. So please feel free to ask any questions.
So I had the microneedling done. Donna did a treatment probably maybe 8 weeks ago. Microneedling to my nose and clear and brilliant laser to the rest of my face, which is a different treatment for different reasons. But the reason we did the microneedling on my nose was I've always had large pores that have bothered me, and with one treatment I noticed an immediate improvement. You know, within 24 to 48 hours it was probably a 50% reduction in pore size.
Microneedling, as I said, is a great procedure for all types of skin, but we have you come in and do a free consultation and assess your skin to make sure that microneedling is the right thing for you. We do offer a lot of other procedures and skin care that we might recommend prior to doing microneedling. So now I'm going to take an alcohol swab and wipe over his skin here as well.
Just to give you an idea of the armamentarium that we have, Michelle, why don't you pan around the room to show some of the machines, lasers, and various treatments that Donna and I have to offer patients for a variety of skin care. So you can see there's no lack of tools for addressing skin rejuvenation in this practice. Donna, why don't you explain the tool a little bit more, exactly what it is and what microneedling is doing.
So this is the skin pen device that we use, and every time I do a procedure we have an individual cartridge so there is no cross-contamination. I'm putting a sheath over the pen, and the tip of the pen, it can go to 0 to 2.5 millimeter depth. So I'm going down into the epidermis and also getting a little bit into the dermal layer as well. So it has 12 fine needles, and these fine needles creates almost like an irrigation, and it allows the skin to have a small injury, which then produces more collagen, and again that helps with the wrinkles, fine lines, helps with the texture. So as you see, new tip every time the pen is being used. I'm going to start with Dr. Lindsay's forehead. It's a similar sensation to tattooing is how I kind of would describe it. And I will be putting on a serum, which is a hyaluronic serum. Because of those channels being open, you want to be very careful with what you're applying to the skin before and after. You don't want to create any kind of irritation. So I'm actually going to do 0.75 depth on his forehead. You will see a little bit of possible pinpoint bleeding, which is normal.
And hopefully no crying.
There's many different ways you can do this. You can do the circular motion, and then also vertically, horizontally, which you'll be seeing me do. When you do the forehead, sometimes it does make me feel as if you might have to sneeze.
We do have a couple of questions.
Okay.
The first one was, is it only used for the face?
No, this can be used anywhere. Face and body, arms, anywhere. Because it's great for, as I said, scars that can be anywhere on the body. They can be old scars. They can be new scars. Even a little bit of hypertrophic. I am now taking a gauze of saline solution and wiping off the pinpoint bleeding. And now I'm going to continue on here on the forehead. How you doing, Dr. Lindsay? You doing okay?
Good.
All right.
Yeah, even with the numbing medicine, you can feel a little bit, but the forehead, I think, is definitely the most sensitive part of our face. But it's very tolerable. And after treatment, I would describe, the first 24 to 48 hours, kind of a sunburn type sensation. Feel a little warm, definitely red for 24 hours, maybe a little longer. But there's no downtime. I'll walk out of here and continue with procedures this afternoon. And I always tell patients, if somebody asks you why your face is red, just tell them you saved a kitten from a burning building. It's your good deed for the day.
We have another question. How many treatments does one person need to have?
Anywhere from 3 to 6 treatments, depending on what the goal is that we're trying to achieve. What's wonderful too about the microneedling is you can get very close under the eye area, so it's really good for the crow's feet, the fine lines. Also, as Dr. Lindsay was explaining about the after care and things as far as how you look, for 24 to 48 hours, you do not want to do any exercising that's going to be perspiring, getting sweaty. And that's pretty much with any of our procedures that we do, because they are more medical grade with doing the lasers. You don't want to get sweaty for about 48 hours after having procedures done. We have another question. How much does it cost? So for a package of 5 is $1,300. And if you do individual treatments, it is $300 for full face. And then it depends on if you are having like individual scars on the body. It can be anywhere from $150 on up.
Okay. We have another question. Is this just for wrinkles or scars?
It's also used for stretch marks. I use it for stretch marks. Not necessarily if they are red, but if they are more skin tone. And it doesn't matter, again, on the age of the stretch mark. Doesn't matter how long. It does improve it. It's also good for hypertrophic scars. I would not say true keloids, but it does also reduce with hypertrophic scars as well.
I think this may have already been answered, but I want to ask again to cover it. Will your face be red for just the day or longer?
So it depends. It depends on the individual. I know when I have it done, I am red that day, and then I have a little pink undertone even the next day. So it depends on the thickness and thinness of somebody's skin, which is also how I determine also the depth of the needle that I'm going into the skin.
I have another good one here. Can you get microneedling done if you're pregnant?
Yes, you absolutely can. You're not using any kind of product that would compromise anything with the baby, and this is just creating a small injury. So yes, it would be fine.
And we have another question. Will this help at all with brown spots?
I wouldn't per se say that this would be the treatment that I would necessarily do for brown spots. It does help a little bit with lightening, but we have many other procedures in the office that would definitely help with pigmentation, and along with products as well.
Okay. Do we have some before and after photos to share?
Yes, we do. We have, yes, we do have a catalog, a book that has some photos in.
And is your face sore after the treatment?
No, well, for about 2 hours, right? I was going to say you can answer.
Yeah, I
that,
wouldn't
Dr.
say
Lindsay.
it's sore. Again,
It feels like
the
a
last time I had
sunburn.
it done, it just feels a little warm, like you've been in the sun, got a sunburn, but no, it's not sore.
It's also great for the lip lines, and this area is a little bit more smarts to have done, but definitely really good for some of those smoker lines.
And coming off the beach after the summer, is it good for the neck and décolleté area?
I feel that yes, it can be done on those areas. I feel that I have some other things that might be a little bit better for those areas. But it certainly can be done. It takes a little longer, I feel, to see the improvement on the neck and like the décolletage area. So now I'm going to do his nose. So I will actually lower my setting a little bit here because of this being very sensitive.
Let me add something to that, Michelle. Bring the camera over here for a second. We'll talk to everyone. I think these are all great questions, and people are asking, does it treat brown spots? Does it treat décolletage, wrinkles, scars? And really, you don't need to have those answers. That's why you come here. We don't charge for a consult. Donna's been with me for 12 years, but she's got close to 20 years of experience. And so with her and my advice, we'll come up with a treatment plan. And I think a lot of people get confused about skincare and how this all fits in, and I'd like to share with you an analogy that I use. You can think of your face as maybe a weathered piece of furniture. If anybody's ever refinished furniture at a garage sale and you pick it up. And it's got some scratches, and it has some stains, and it has some gouges. And a lot of people pick it up and they get a good deal on it, and then all they do is put Pledge on it. And it looks better, but it still looks old. Well, Pledge is like all the products you buy over the counter when you go to Boscov or Target or something like that. You're using them sort of in a vacuum. When you think about refinishing a piece of furniture, you're sanding it down smooth. You're filling in deep gouges with wood putty. And then you're using a variety of stains, varnishes, and polishes to make it look new. The way to think about microneedling here is it's one tool in that whole armamentarium. It's essentially a type of sandpaper. So when we have deep gouges in the skin, deep creases or wrinkles, we'll use fillers. You've all heard of the hyaluronic acid fillers. We did a Facebook Live on Juvederm. We then have a variety of different kinds of sandpapers, and all those lasers that we panned by and this kind of treatment, they're all different gauges of sandpaper. And then we have a whole variety of products that are essentially the varnishes and the polishes. And that's where you need an expert opinion to help put the whole plan together to make your skin look good. So this is a fantastic tool, but it's just one small, really small aspect, very effective, but a small aspect to the bigger picture. So when you come in, we're going to do a full assessment of your skin, and we're going to come up with a treatment plan that kind of fits your lifestyle and meets your goals. So with that said, we'll go back to Donna.
So I'm now on the other side here of Dr. Lindsay's face. As you can see, the erythema.
We have another question. Does this always work for everyone?
I think again that goes back to what Dr. Reedy was just talking about. It can be done on everyone. It just depends, by assessing the skin. I have had wonderful results. I do this on a daily basis. That's pretty much, how popular this is. And so far, everybody has been very pleased with this procedure. So, it just depends on what we're trying to achieve.
How are you feeling down there?
Good. Feels good. A couple little areas a little more sensitive, but...
We have another question. What is the downtime?
There's really no downtime other than being red for at least 24 hours. And you also, I did forget to mention, you do, in about like 2 days or so, you may tend to get a little peeling. That's the skin just re-epitheliating, and the next day you are able to wear makeup. The day that you have the procedure done, you are not able to wear makeup for 24 hours. But you don't have to be in hiding. And 15 minutes after you have the procedure done is when you want to apply sunblock.
We have a really good question, actually. Are there special follow-up skincare products to use afterwards?
Yes, there is. So first I want to tell you, prior to doing the procedure, we will have the patient on skincare products for their skin and get their skin in good condition and quality. Then when they have the microneedling done, they will get a kit. It's called Skin Fuse. It actually comes with the skin pen. They will use that 3 days to 5 days post the procedure. Then when they are done with that, then they can go back to their regular products, because again, you want to be careful with the products that you're using, because it's going to feel a little more dry, a little more tight. So you want to use like things with hyaluronic acids, vitamin C, sunblock. Those are the things that you want to use at least for the first few days after, and then again go back to your normal regimen.
We have another question that I'm going to kind of alter a little bit. The question was, can I do microneedling after injectables? My question would also be, can you do it before, and is there a certain time frame around which you should do it?
So you can do it before, and then I would say maybe within 24 hours you could do the injectables. I mean, I don't know that you would necessarily want to do it right afterwards, but if you had the injectables first, I would say to wait at least a week out prior to having the microneedling done. So you wait a week after you have the injectables, and then you could have the microneedling. If you have the microneedling first, at least 24 hours, you could do the injectables.
And if I can add to that,
sure.
You can keep the camera on. Again, it's to go back to that analogy of refinishing furniture. If you have a very deep gouge, so think of a deep fold or a deep wrinkle, on a table on furniture, you would fill that in with wood putty before you would start sanding it. We do the same thing on the face. We like to treat the deeper things, do the fillers and the Botox first, and then we start working on correcting the minor imperfections in the skin.
So I do want to show how I can also do this on the eyelid. I did the other one when questions were being answered. So I want to show you how this can be done on that as well. A lot of things you have to be very careful with doing the eyelid. So again, I'm changing my settings because the eyes are very delicate, very thin skin. So I'm going right under the brow area.
Dr. Lindsay, how does that area feel? Similar to the rest?
Yeah, it's a little more sensitive. I didn't have numbing cream on my upper lids, but I think they were still a little numb.
Okay.
And kind of talking about the the whole spectrum of skincare. You know, for me personally, I use kind of a basic skincare regimen with a cleanser that has an alpha hydroxy acid, a beta hydroxy acid, and exfoliators in it, and then a retinol product, and then a good sunscreen. And you know, each patient is different for the problems you're trying to correct and your needs, and those are all things that Donna will help to, you know, personalize a treatment plan for you.
So I am now applying the Rescue, which is basically a hyaluronic serum, which helps to hold in moisture, and it feels very nice and soothing. And this is the only thing that needs to be applied for the rest of today. And then we have a kit back here that has his products for the next few days. He will be using these. This is the Skin Fuse post-procedure protocol. The Rescue also comes in here. It tells you exactly how to use the products for, like I said, the next 3 days. You get a cleanser, you get a vitamin C, you get a moisturizer, and you get a sunblock. And that comes with the package of 5. And then after that, like I said, then they can go back to their normal regimen with their retinols, their growth serums, their hyaluronics, their facial scrubs, all of the important things, sunblock for sure. So he has to wait about 15 minutes before he can apply sunblock, again, because those channels need to kind of seal up. And that's our microneedling.
Dr. Lindsay, do you have anything to add?
No, it's a very comfortable procedure. And again, I think it's a great tool, and you know, the armamentarium that Donna has, and the different things that we have to offer for skincare.
So I want to thank everybody for joining us today. Again, I'm Dr. Brian Reedy from Berks Plastic Surgery in Wyomissing, Pennsylvania. You met Dr. Lindsay, my associate, Donna Erb, my esthetician. This is Steph Deswart, my patient coordinator. And then behind the camera, who you haven't seen, is Michelle O'Grady, our front desk receptionist. I encourage you to give us a call, 610-320-0200. You can visit us on the web at www.berksplasticsurgery.com. We'll be happy to answer any questions, and thanks for joining us. We look forward to seeing you.